Hi, I'm Dr. Abhimanyu. I'm a consultant orthopedic sports and joint replacement surgeon at Center for Sports Injury. Let's talk about a very common injury known as ACL injury, particularly seen in athletes and sports persons. What is the ACL? ACL, or the Anterior Cruciate Ligament, is the most important ligament and stabilizer of the knee joint. It is a ligament that is seen in the front of the knee joint. This stabilizes the knee and does not allow any rotation, excessive rotatory movements or forward backward movements of the knee. How is the ACL injured in sports persons? Any contact sports where there are frequent changes of direction, like in hockey, in football, in rugby, and basketball. Because of the sudden changes in direction, there is this rotatory movement which is known as the pivoting movement, which can lead to an injury of the ACL. Also, a direct impact to the knee, and if you are landing on the knee in a wrong position or an hyperextended position, like in the case of volleyball and basketball, you may end up tearing your anterior cruciate ligament. How would you know if you have an ACL tear? The patient generally gives a history of impact or injury while playing sports. They may also hear a pop sound in the knee joint or a giving way sensation in the knee joint. The patient complains of severe pain, swelling, and is not able to put weight on that particular limb immediately. How do we diagnose an ACL tear? The ACL tear is diagnosed with the help of an MRI or a magnetic resonance imaging scan. Most of the orthopedic and sports surgeons also get an X-ray done to rule out any associated bony injury. Now, what is the treatment of an ACL tear? The treatment of an ACL tear depends on the grade and the nature of the tear, and also the physical activity level of that particular person. In case of partial tears or ACL sprains, an immobilization with a splint or a brace and graded physiotherapy along with certain medications and injections in the knee joint may suffice. However, if you have a complete ACL tear, surgery is the only option, as it doesn't heal on its own. ACL surgery is the most commonly performed arthroscopic or keyhole surgery for any sports injuries. We use two small nicks and use telescopes to visualize the inside of the joint in a magnified way. Once we diagnose the particular injury, the treatment is either an ACL repair, which is rarely done, or an ACL reconstruction, which is most commonly done. What is the difference between an ACL repair and an ACL reconstruction? In specific indicated cases, and in younger patients, the ACL can sometimes be repaired and reattached to its attachment on the upper bone, which is known as the femur. That is known as the ACL repair surgery. However, there are only specific indications for ACL repair surgery, and it cannot be done for every patient with an ACL tear. So what is the more common procedure that is done? That is the ACL reconstruction surgery. What is the ACL reconstruction surgery? In the ACL reconstruction surgery, tendons are harvested from your own body, which may be either from the hamstrings or from near the foot, or maybe the quadriceps tendon is harvested and prepared, and a new ACL ligament is put inside the knee joint. What is an internal bracing? In internal bracing, we use synthetic materials like fiber tape to provide additional support, increase the strength of the ACL graft that we use as the ligament. What is the role of physiotherapy in an ACL reconstruction surgery? Physiotherapy plays the most important role post ACL reconstruction surgery. The aim of the physiotherapy is to make the muscles flexible and regain movement at the knee joint, followed by strengthening these muscles to avoid any re-injury and make the person get back to their sport safely. Have you undergone an ACL reconstruction surgery? Do you want to know how long it takes for you to get back to your normal day-to-day activities? Post an ACL reconstruction surgery, the patient is made to walk without putting weight on that particular leg the same day or the day after the surgery. With routine physiotherapy and rehabilitation, most patients get back to their normal day-to-day activities with a protective brace after 4 to 6 weeks. High impact activities like running, jogging, jumping are started after 2 to 3 months of rigorous physiotherapy. And most patients get back to their active professional sports within 9 to 12 months. What's different at CSI? At CSI, we have a team of internationally trained orthopedic sports surgeons who will evaluate you comprehensively. We also have diagnostic features like sports MRI and open MRI and various other radiological investigations that are needed. We also have our own sports physiotherapy department and unit to cater to the needs of a post-surgery physiotherapy and rehabilitation in cases of ACL injuries, all under one roof. We also have 2 modular operation theatres with state-of-the-art, modern, most sophisticated arthroscopy sports surgery equipments for the best results and maximum precision. Subscribe to our YouTube channel for more such informative videos.